Welcome. My name is Cindy Wright, and I'm a program manager for the Child Neurology Foundation. Today's talk is part of an ongoing series on emerging issues that children and families with neurologic conditions are experiencing as a result of COVID-19. These sessions bring together caregivers and health professionals to have a candid conversation and provide their expert advice to the child neurology community. Today, we're discussing how to teach kids to wear a mask with Nina Grinzer and Gabby Conacher. Welcome to you both, and I'll turn it over to you, Gabby, to introduce yourself.
Great. Thank you so much, Cindy. Excited to be here with both of you today. So as Cindy said, I'm Gabby Conacher, and I am mother to two children, one of whom is my 7-year-old son, Elliot, who has very complex medical history and is impacted by an SCN8A-related epilepsy mutation, and his 4-year-old sister, Vega, who they love each other dearly. So it's nice to be together a lot these days. I know a lot of people have their families packed together. So I'm the co-founder of Wishes for Elliot, which is working to advance SCN8A research and advance the understanding of severe epilepsies. And most recently, our newest project is Deep Connections, which is focused on trying to help families get access to critical information through webinars with both experts in their field and caregivers sharing their experiences. So really excited to be here with you. Nina, do you want to give a quick intro of yourself?
Yes, thanks for having me here. I'm excited to be here with both of you. So my name is Nina Grinzer. I am the program manager of the Language and Learning Clinic at the Marcus Autism Center, where we're also associated with the Children's Healthcare Atlanta. And my focus is really helping children on the autism spectrum disorder or with other related disabilities, learning functional communication skills and early foundational learning skills to get them to be in the least restrictive environment possible. Mm-hmm. And so we are excited today to talk about probably a really hot topic right now, right, Gabby?
Indeed. Yeah, it's really, all of us, with things starting to open up, I think a lot of us are thinking about when we can reemerge. And if we do, how do we protect our families? And part of that is really the, mask wearing, which, CDC and everybody is saying is a really critical component of preventing the spread of coronavirus. So I know a lot of parents are really struggling with getting their kids who have, complex health issues and complex learners to get to wear their masks. What kind of guidance are you giving to families or hearing from families about what works to get their children to not only put the mask on, but keep it on?
Yeah, that's a great question. Wearing masks can be very challenging. I don't think it's something that we're all used to, or even if we are having to wear them, probably not necessarily enjoying them. So how to get children to wear this as well can be very challenging, and I'm sure very frustrating for a lot of parents. Yeah. I think kind of the first step that I would recommend is trying to kind of explain to your child, why we have to do this, why we need to have these different routines, to the best that you can, depending on your child's level of functioning. And this can be helpful to you incorporate different visuals or social stories to help kind of illustrate why we have to do these different things and why it's important to be wearing a mask. And but that can also be very challenging, especially for young children or for children who do not yet have that understanding of what's going on. Mm-hmm. And I think for those children, it's important to still try to explain to them as much as you can, but then really focusing, I think, on tolerance of wearing the mask, as it's not going to be something that they're probably going to enjoy wearing, especially for kids who don't really like to have clothes on them or are very sensitive to different fabrics. This can even make it even more challenging. I think sometimes you might have to make difficult decisions on who is going to reemerge, and who's going to reemerge into what activities. But learning how to wear a mask is going to be probably a critical component for everyone at some point, depending on the type of activity you're going to do. So really trying to educate, but then pair the mask with other things that the child may like, to make sure that that mask isn't something like scary, it's not something to be afraid of. So just kind of exploring it as much as possible, and teaching tolerance of having the mask just being in front of you, to then maybe the mask being close to you, to maybe even just having other people around you wear the mask. So parents can maybe model, like, this is what a mask looks like and how you wear it. And although you can't see my face, it's still mommy, it's still daddy. And for younger kids, it might be hard for them to recognize those familiar faces. And so it might be a little scary for them, but if you can teach them in the comfort of your home and practice that, you can prepare them for a more successful community outing. But I think a caveat for that is that it's not going to be just like overnight or a one day, practice that your child is probably going to be ready to go. It's going to take a lot of practice trials and maybe multiple days of practicing before you're probably ready to go out on that community outing where you're going to have to require your child to wear a mask. And how fast and how slow that process will go, I think really depends on your child and their comfort level with that. And so finding things to make it as less scary as possible, and taking it step by step with your child and not overdoing it to make it become something that's aversive, because it's probably already starting to be aversive from the first place. So taking steps to make it less would be important.
Yeah. No, it's really, I think not just about getting to wear it, but then to be able to tolerate other people wearing it and understanding that they're still the same person behind the mask. With my son Elliot, we put masks on pretty much whenever we go to the hospital. Most of his care is centered at a hospital, so he wears one. He doesn't like it, he'll thrash his head around. But yeah, I think putting it on myself and having him, he's got limited vision, so it's still, he does touch, so feeling me and knowing it's still me, and kind of talking in a way that's soothing, and trying not to get too upset or worked up about it, because we know that never helps, but it's really hard. And I guess, one thing that I think could be confusing is that they only have to wear the masks in certain situations, right? So like having to not only communicate about wearing this thing and why it's important, but the distinction between, when we're around other people, when we're out of the house, you have to wear it. I don't know if that's something that you've considered, or whether you have some thoughts on how to manage, because it's a lot of complex, stuff that we're dealing with here.
Yeah, and I think it's very unclear of, like, sometimes you wear it, sometimes you don't, and why do you have to do that? I think to be as clear with expectations as possible. So trying to make sure, like, in all of these contexts, we wear a mask, and in this context, we don't. But I know there are probably situations where it's like, oh, but we're with family, so we don't have to. But it could be for other family members that even if you are with family, you still need to wear a mask and be practicing social distance because they may be more at risk during this time. So I think if you can define clear boundaries, that would be helpful for kids to know when they have to and when they don't. Like every time we go to the grocery store, we're going to have to, but at home, we don't have to. And then if there is someone maybe at home that does get sick or is sick and needs to quarantine, trying to have them be separate, so then that way you can still have that same rule at the house where the child maybe doesn't have to wear a mask until it's safe. But then if you do have to make those changes, trying to explain as much as possible, or finding ways, or are there special spots where kids can go where they don't have to, because no one wants to wear a mask 24/7. And I have so much more. I don't know how our healthcare providers do this on a daily basis, and I'm now getting to be in their shoes, and it's crazy to then have children also do this. Can be a daunting task, but I think just remembering to be patient with the process and to pick the battles of when you need to be wearing it, and then finding times that you can, still go to places that maybe like an open soccer field where you can have a lot of space where you don't have to be wearing a mask, and making it clear when you do have to, and incorporating some sort of like reward system might be important for children to learn to keep it on.
Yeah, and that's what I've talked about with some other folks too, is just maybe trying to incorporate something that's very comforting, you know, having a favorite blanket or toy or something that you carry with, or, you know, if you really have to be out, you know, having an iPad that can distract the kid from even thinking that, you know, recognizing that they're wearing something. So yeah, I think that's, you know, all of us, no matter, you know, what our kids are like, are having to do a lot more reward systems these days, I feel like.
Yeah, and I'm sure having to get pretty creative too with what those reward systems can be.
Exactly. Yeah. Right. Yeah. And I wondered also, you know, what I'm thinking a lot about is, you know, we know that like putting masks on and off are also touching our faces. And so like, there's the whole complication of too, like, you know, to put it on appropriately, you're supposed to have clean hands first to put it on, and then wash your hands as soon as you take it off. And it's just like, I mean, do you also think that there's some critical communication around face touching that could come into play here? You know, a lot of kids sticking their fingers in their mouth or in their noses, or
yeah, I think that is a very big challenge with young kids of wanting to touch their face. And I think we can do our best to explain, you know, why we don't want to, but I think there's just always going to be a degree of some face touching. And so being able to, I think, just do your best in those situations, talk about it, practice not touching your face. If you can, kind of like block and redirect their hands to something else. I like your point of like having them, when you have to wear a mask, can you keep their hands busy with something else? So can they watch an iPad? Can they hold something comforting during that time? And if their hands are competing with other things, it's going to be competing with touching their face, which can be helpful. And then just considering like how long can your child tolerate wearing the mask? You know, you'll have to go through teaching them how to, you know, not only just wear it, but keep it on. And so practicing first with like short durations before doing like a bigger trip. And so that way they can contact success of wearing the mask, and make that kind of outing pleasurable for everyone. But it also might be something you have to look at establishing a very powerful reward system. So considering, do you have to have something special for just mask wearing only? It's often we use the iPad for a lot of special things, but I think right now, often the iPad is to help kind of keep everyone happy and entertained for longer periods of time that they're having to be forced at home and can't go outside. So that might not be the item that you get to use. Because kids may get satiated over that, and it loses its value where you then don't really care about it as much. And so you might have to have something even more special just for kind of keeping the mask on and following those expectations of what it means to be wearing a mask.
Right. Yeah, no, that makes a lot of sense. And in terms of the hand washing thing, I'm just also thinking about, you know, what we do for my youngest kid when she was 3 and 4. It's like, just make hand washing fun, you know, feeling to textures, thinking about this and singing a song, you know, you sing the alphabet or Twinkle Twinkle or something. So kind of making it a more, not like a, you know, oh, we got to do this thing. It's like a, yay, we get to do this thing. And, you know, have, you know, maybe foaming, you know, soap that is more exciting.
Yeah. And another way to like make wearing a mask more fun could be trying to pretend that you are like superheroes wearing masks, or you're on a mission when you go out, and kind of adding that creativity to it, if that's something your child's into, or even simply like, you know, having choice is helpful. So no one likes to be told like, you have to do this. And you might see a lot of kids like, no, I don't want to wear the mask, but instead it's, you know that the child's going to need to wear a mask, present the choice of, do you want to wear this mask or this mask? And then it seems a little bit less daunting, and having some more independence and control of the situation can be helpful.
Right. Yeah. And the reframing of it, right? It's like, oh, you get to wear this cool thing. Like if it's,
Yeah.
and making, since we can make masks, so you're making, what they like on it. So it's Superman or, Hello Kitty or whatever kids are digging on these days. I'm very old, so I don't know what those things
Yeah, I
are,
think it's
but
like puppy pals and bubble guppies and all sorts of things.
those
But I
things.
also know families say like, oh, I picked out, this special fabric, or we do a lot of toilet training too. And so like,
Mhm.
oh, I'm going to pick out special underwear that has these characters, but nope, children don't care about it. So I think even if you try to make it fun, for some kids, you're still going to have to kind of teach that tolerance and expectations of it and using other rewards. But then for other kids, having them be a part of it and making it fun and having choices can also be very effective.
Yeah, no, definitely. Another thought was, just in thinking about mask wearing and being out in the world, it's not just about masks and washing hands, but about social distancing, which is so hard for a lot of these kids because they love to give hugs or give high fives or be near people or, touch people if you're visually impaired to like see who it is, to feel their faces. So this kind of the minimum of a 6 feet circle or range around people who are not in your circle is really tough. Even with my 4-year-old, I'm like just holding her shirt when we're like anywhere near a friend that comes to drop something off or something. Like, no, you can't go any closer. So apart from leashes and restraint, do you have thoughts about kind of making that something that's less restrictive or frustrating?
Yeah, I think that's really hard, especially if you, you're used to seeing friends and having play dates, and now you can't, or you can, but you need to be further away. The social distancing part is hard, but like it's when you can't social distance, it's also important to have the masks to be able to help with that. And so I think it's just like doing our best of trying, but knowing that it's not going to be perfect, but knowing the more that we try to encourage and model social distancing, having caregivers practice, like, look, I'm doing it, and hopefully that will encourage children to practice with them and make it easier. I think if we show like, oh, well, I'm not wearing a mask or I'm not social distancing in a situation, then, when you ask them to do it, that's going to make it more challenging for them to want to do that too, especially because it's usually going to be access to something that they want or are used to having, and this change is different. And I think, again, trying to talk and explain about the situations and the new changes and routines can be helpful, incorporating visuals if possible, and just also validating those feelings of frustration, and that they're upset, and it's okay to have those feelings right now. We're all upset about these situations and trying to figure out how to adjust, but just really just trying to do the best that we can, and knowing that as we practice this, even doing it to some degree is still helpful and still keeping everyone safer than if we weren't trying to practice these recommendations.
No, that makes a lot of sense. Well, thank you so much for sharing your wisdom and experience with us around these issues, and how to kind of manage things in the midst of all of this chaos. So really
Yes, thanks
appreciate
for having me. And here's just a few resources to help with some different social stories that you can have to incorporate why we need to be wearing a mask. There's some good free resources available out there, as well as these are the lists of kind of different steps on how to teach some tolerance with mask wearing that you can take, and just to remember to practice, be patient, and we're all in this together.
Awesome. Thank you both. This was so great and helpful. I know our families are really going to appreciate this. So I'm going to stop sharing here, but I want to thank everyone for joining us today. This concludes the conversation, but we have additional resources for families on our COVID Resource Center, and that's at www.childneurologyfoundation.org/COVID-19. Together, we will all get through this, and together, we are all child neurology. Thank you.